the greatest struggles for respiratory patients is poor nutrition and unhealthy body weight. In this video, we'll talk about the reasons why and suggest some strategies to improve nutrition, make mealtimes easier, and maintain a healthy weight. It's not unusual for respiratory patients to be underweight and suffer from malnutrition. The simple act of breathing can use up to 40% more calories for someone with COPD than someone with healthy lungs, so those with a respiratory condition need to ingest more calories and follow a healthier diet in order to maintain a healthy body weight. On the other hand, some patients can struggle with extra pounds as well. Sometimes feelings of breathlessness can make respiratory patients inactive, so they gain weight, which makes them feel more uncomfortable and more inactive in a downward spiral, which can lead to excessive weight gain. One of the factors that plays a role in unhealthy weight is taste dysfunction, meaning the alteration of the sense of taste. It can cause patients to be underweight because food doesn't taste good or they can't taste it at all, so people don't feel like eating. It can also cause people to be overweight because they turn towards unhealthy, saltier, or stronger tasting foods because they can't taste subtler flavors. There can be several reasons for taste dysfunction. Smoking is detrimental to taste. If you haven't quit yet, please quit. And if you've recently quit, it may take some time, but your sense of taste is likely to improve. Medication can also cause loss or alteration of taste. Many patients complain that prednisone causes a metallic taste. Inhaled medications, such as corticosteroids, can leave an aftertaste or affect taste sensitivity over time. To help with this problem, talk to your doctor. They can investigate and perhaps find the cause and therefore find ways to cure or improve it. There are other strategies that you can try as well. If you use an inhaled medication, rinse your mouth after each dose. It will help wash the taste out of your mouth as well as prevent a fungal infection known as thrush. After taking a medication, whether inhaled or a pill, use mouthwash. If your medication is a chalky pill, you can purchase gel coverings to put them in to eliminate contact with your tongue. You might also try rinsing your mouth with water combined with a tablespoon of baking soda. When you brush your teeth, also brush your tongue or use a tongue scraper. Chew some minty, sugarless gum to alleviate any metallic or bitter taste. Mint or cinnamon candies can also be used. Herbal teas may soothe the inflamed throat or bronchial passages, as well as mask any medicinal taste. Eat an orange or other citrus fruit or drink some fruit juice. They're good for your immune system and good to freshen your mouth. Even if your sense of taste is diminished, don't load up on salt to make your food more flavorful. Salt can raise your blood pressure as well as cause fluid retention, which makes breathing more difficult. Instead of salt, there are other flavorful spices that you can try. Thyme can add an earthy taste to your food with hints of citrus and mint. A German study found that thyme improves mucus clearance, and it may also help relax airways, improving airflow into the lungs. Turmeric is a flavorful spice that has an anti-inflammatory property, as well as antioxidants to boost your immune system. Hot peppers often have capsaicin, which is beneficial for increasing blood flow and lowering cholesterol. A 2002 study of ginseng found it improves respiratory function, as well as increases stamina for exercise. Red sage is an effective antioxidant and protects the linings of blood vessels from injury when oxygen is temporarily cut off and then resumed, as in the case of a COPD exacerbation. Oregano has carvacrol and rosmarinic acid, which act as a decongestant and histamine reducer. Have fun, experiment. In addition to taste issues, some foods can negatively affect your breathing, making mealtime less enjoyable. Begin keeping a detailed food diary. Record what you ate, how big a portion you had, what time you ate it, and how it made you feel. This nutritional detective work will help you know what foods make your symptoms worse or cause indigestion. Preparing meals can be exhausting for respiratory patients. Plan ahead and make foods that will refrigerate and heat well to cut down on prep time. Cooking smoke and steam from the stovetop can negatively affect your breathing, so be sure that your kitchen is properly ventilated. About 20 minutes before eating, do the active cycle breathing technique to clear out any congestion in your lungs and make breathing easier. This technique entails pursed-lip breathing, deep or diaphragmatic breathing, and huff breathing or huff coughing. If you're not familiar with how to do this technique, check out our other video on how it's done. The link is down in the comments section. When your stomach is too full, it pushes up against your diaphragm, making it hard to breathe. Instead of eating large meals a few times a day, eat smaller portions more often throughout the day. Two of the most important foods for respiratory patients are fiber and protein. Fiber helps to reduce inflammation, and protein is essential for muscular health. It is suggested that lung patients eat 20 to 30 grams of fiber and 2 servings of lean protein per day. Try to eat these earlier in the day if your appetite tends to wane as the day goes on. Those battling a respiratory disease may not be able to ingest as much food as they used to, so it's important that they prioritize the essentials. Posture is important, not only for easier breathing, but for easier digestion as well. Sometimes it's tempting to eat on the couch or in a comfy recliner, but it will help your digestion if you sit up straight at a table. Slouching over on a soft couch causes you to push against your stomach, making it more difficult to digest food. Be sure to eat slowly. Take smaller bites and chew thoroughly before swallowing. Try to pay attention to how you're breathing while you're eating. Many find that they hold their breath while they're bringing food to their mouth or while chewing. This is likely to cause you to feel short of breath and uncomfortable before too long. Breathe slowly and deeply throughout your meal. Take a short pause between bites. If you've been prescribed medical oxygen, be sure to wear it while eating. After eating, some gentle movement will aid digestion, such as a slow stroll around the block. Don't eat too late in the evening, and don't lay down for at least 2 to 3 hours after you've eaten. Following these strategies will not only make mealtimes more enjoyable, but will hopefully help you maintain a healthy body weight as well. Be sure to check out the First Class Medical YouTube channel and Facebook page videos for more valuable content. Please subscribe so that you don't miss any new videos.